You know that Ipilimumab was approved in advanced melanoma in 2010, and you know that the dosage that we usually use is 3 milligrams per kilograms. Anyway, in the previous studies, also with the 10 milligrams per kilograms in a phase 3 trial where we combine with Dacarbazine, we got an improvement over survival. So, despite of the dosage that was approved 3 milligrams per kilograms, the FDA committed this trial in order to see if there is any difference. The trial started in March 2012 and enrolled in just 5 months 727 patients. So very short. Why this? Because at the time we did not have any possibility for our patients. So the trial compared the two different dosage, 10 milligrams per kilograms and 3 milligrams per kilograms, every 3 weeks for 4 dosage. No other treatment, but in case of response or stable disease more than 3 months, it was possible to reinduce the patients. If you look at the data in terms of overall survival, they are very positive in favor of the 10 milligrams per kilograms. These are consistent at 1, 2, and 3 years. So at 3 years, we have the 31% of patients still alive in the 10 milligrams per kilograms versus the 23. And if you look at the median, it's more than 15 months in the 10 of IP and more than 11 in the 3 with an hazard ratio of 0.84. And this means 16% of risk reduction. It's really interesting to see that if you look at the surrogate endpoint, progression-free survival, response rate, disease control rate, it's really similar. This is what we observed in the previous study. What about toxicity? Even the toxicity is consistent with what we have seen in the previous study, the same kind of toxicity, but in the 10 milligrams per kilograms, the incidence was higher, with a percentage of patients who discontinued the treatment of 31% versus 90% of the patients in EP 3 milligrams per kilogram. So, in conclusion, DP10 showed a better survival, and this is despite of no evidence of difference in the PFS, objective response rate, disease control rate. The toxicity was higher in the EP10, 31% of discontinuations versus 19, and we should put this data in the context of the treatment landscape that we have today. In first line, we have the EP combo with the nivolumab and the BRAF plus MEK, but in the refractory patients, resistant patients, EP10, it's another important toxicity we know from this trial, and this approach should warrant further investigation.